The question is there a connection? I'm going to rephrase it. Is there a connection between a headache and a stomach problem? Could the stomach cause the headache, and vice versa? Could the headache?
So do we localize or internalize pain in different areas?
Well, there is something called, the visceral migraine. So you may not have it in the head, but you may have developed it somewhere in your stomach, in your internal organs. So is it a substitute? Is there a connection between the lack of a headache and the internalization of the pain another place? I don't know. I cannot speak to that. But I can tell you that, yes, we are all interconnected on the inside. I mean, what's happening in your stomach has a lot to do with what's going on in your head. So you could be triggering it there. Maybe it's not manifesting in the head, but it's manifesting in the stomach.
And I think people are a bit like snowflakes. They're all a bit different. Nice. And in the setting of, in the real setting, people have trends or types that we might be able to, some of the ancient systems like Ayurveda systematize different body types. And certain types of folks tend to somatize with a stomach ache or indigestion. Some people have headaches. Some people, maybe from family history, are imposed with a predisposition to heart pain or other kinds of tendencies. So you get these tendencies, and then nature, nurture, and all of that happens. In my world of treatment, you might be one of those people when you're really tired or stressed or becoming ill in any way. This is your barometer, and it tells you how well you're doing. So learning through that self-referral basis who you are and what works for you seems to me to be one of the good tools that folks have that keeps their pain level under control or keeps them from getting sick. And folks often tell me, I know what works for me. All I have to do is take a 2-mile run and I'm fine for the day. Or I know what works for me. I take an Alka-Seltzer, I go to bed early. And this knowledge of oneself seems to be how you treat your uniqueness. With chronic pain syndromes, it seems to work.
I think this is absolutely correct. This is where we're beginning to head in that direction. Personalized medicine that would actually look at you as an individual rather than as one of many, and move us gradually away from the magic bullet that we've been looking for, the single blue pill that would erase all pain, and try to begin to develop some kind of a custom-made treatment, if you want, that would help individuals rather than be the lowest common denominator to the collective, which end up not working for anyone in most cases.
And adding to that, this family tradition and lore of Arkansas, my family goes way back 6 generations, and there was this oral history of what you do for a bee sting, or I think that also gives the individual a great sense of confidence in their own health. Grandma always said we take the sassafras root, we blend it with the sugar, and we take that. Or I can remember my grandmother going to the pharmacy and giving us Coke syrup when our tummies were upset. Very old-fashioned, but not only do you get that good, healthy placebo effect of the good expectation of care, which is a real effect, and we want to incite the placebo effect, I think, don't we? Because it causes good things in the brain, but also there may be some legitimacy to how cultures and families take care of themselves. So this family lore.
If I may intervene one more time here, we do not want to underestimate the effect of placebo. I mean, many of you may know already that real drugs actually work anywhere around 10 to 20% at most above placebo, especially in pain. So, yes, I see some people frowning about that. So basically, placebo is a very important tool to tap into, not just as a control for what may be an effective therapy for pain, but also sometimes as a therapy in and by itself. It works for many. The range, if you look at the data for effectiveness of placebo, is anywhere between 6 and 80%. If you look at the effectiveness of active ingredients in drug, it's overlapping. Now, it just happens that by study design, the mean efficacy is a little bit above the mean efficacy for placebo. So we get the significance, we get the FDA approval, and we market it. It's not an attack on drugs. They help a lot of people, but it's actually a little bit to raise awareness as to the efficacy of placebo out there. It's not something to underestimate.
So for someone like you that knows about these medical studies, is the placebo effect ruined?
Actually, it's an interesting question. Many people wonder whether with the increased information age that we have today, the access to the internet, to Wikipedia, to all the medical websites out there, whether we would still respond to placebo the same way as we would if we had no clue as to what's going on with us. And the answer to that is still to be found. We don't know yet. I mean, many people would say it would actually have a negative effect on placebo. Many others would say no, it would not affect it at all.